Our next speaker will be Dr. Raghad Alakel, is a senior medical student at the King Saud bin Abdulaziz University for Health Science in Riyadh. She will be graduating soon, and she is interested in both ophthalmology and pediatric field, more specifically pediatric hematology. Her presentation titled The Impact of Total Parenteral Nutrition Survival Rate and Complication in Pediatric Stem Cell Transplantation. Please, Dr. Raghad, you can start your presentation.
Okay, Assalamu alaikum. So my name is Raghad Alakel. I'm a senior medical student at King Saud bin Abdulaziz University for Health Sciences in Riyadh. So this is our topic. It is about the impact of total parenteral nutrition on the survival rate and complications in pediatric stem cell transplantation. Next, please. Okay, for the background first, hematopoietic stem cell transplantation is considered as a curative treatment for both malignant and non-malignant disorders, but patients might present with some complications such as mucositis, vomiting, and diarrhea, and these complications are very common. And so the nutritional support with total parenteral nutrition is usually used. But there are some complications which we fear, and these complications are related to the central venous catheter, such as infections, metabolic disturbances, including abnormal liver function. The aim of our research was to identify the complications of TPN and to estimate its impact on the survival rate. Also, this study compared between the rate of complications between TPN and non-TPN patients. Next, please. For the methods, this was a cohort retrospective study in which electronic charts of pediatric patients who fit our inclusion criteria were reviewed. And our inclusion criteria was all pediatric patients, both gender, who underwent stem cell transplantation between 2015 until 2018 in King Abdullah Specialist Children's Hospital in Riyadh. And the number of pediatric patients we got was 162. Next, please. For the data collection, patient chart on best care system were reviewed, and we collected data about the clinical characteristics like the age, gender, primary diagnosis date, type of transplant, and the nutritional profile. And I will show you later on a chart about that. Also, for the conditioning and treatment modalities, data were collected including the type of conditioning, if it is chemotherapy or radiotherapy, the regimen intensity, and the duration. And lastly, we looked for complications including mucositis, graft versus host disease, hepatic veno-occlusive disease, bacteremia, and finally, the patient's outcome. Next, please. For the result, a total of 162 hematopoietic stem cell transplants were identified during the period I mentioned before, and patients' characteristics are shown in this table. 124 of them were allogenic, and 38 were autologous. And for their age, 30 of them were less than 2 years old, and about 2 to 5 years old. 38 of them were about 2 to 5 years old, and 63 of them were from 5 to 10 years, and 31 of them were greater than 10 years old. And for their gender, 79 of them were males, and 83 were females. For the source of stem cell, 135 were bone marrow, and 27 were peripheral blood stem cells. For the type of conditioning intensity, 41 were reduced, and 118 were myeloablative. For the type of nutrition, 96 were in TPN, and 8 were on the nasogastric tube, and 58 tolerated the oral intake. For the outcome, 16 were dead, and 146 were alive. And for the diagnosis, 31 were presented with hemoglobinuropathies like sickle cell anemia or thalassemia, and 21% were having a brain tumor, and 13% were for acute lymphoblastic leukemia, and 35 presented with other diagnoses like MHC2 deficiency and so on. And here in the allogenic group, the indication of allogenic transplant included hemoglobinopathies in 50 patients, or 31%, and brain tumor in 34 patients, or 21%. Next, please. So out of 96 patients who were dependent on the TPN, 64 patients, or 66.7%, had severe mucositis, in comparison to 17 patients, or 25.8%, who were either on the nasogastric tube or tolerated the oral intake. And the p-value was 0.00. And also here in the hepatic veno-occlusive disease, it was seen in 14 patients, or 14.6%, who were receiving the TPN, compared to none in the non-TPN patients. And the p-value was 0.001. However, there were no statistically significant differences in graft versus host disease, both the acute and chronic, and bacteremia and patient outcome between both groups, TPN and non-TPN patients. Next, please. So in conclusion, the nutritional support using TPN is used in the majority of patients, especially post-myeloablative conditioning associated with severe mucositis, and TPN was associated with the veno-occlusive disease, especially in hemoglobinopathy patients who received the myeloablative therapy. And this may emphasize on the use of preventative measures, such as fluid restrictions, use of diuretics or defibrotide in high-risk patients. And a larger study is needed to confirm our results and to control confounders at a larger scale. And that's it. Thank you so much.